Hello, and welcome to BayView Professional Associates Online, where we are bringing incredible mental health resources to your fingertips, to your desktop, to your couch, wherever you might be viewing this video. I'm Katie Emer, and today our topic is going to be agoraphobia and anxiety during COVID-19. We'll talk a little bit about how the pandemic is affecting these disorders and how we can still help and treat as well during these times. And so today we have a fabulous guest here with us. We have Dr. Heather Harcourt, who is a licensed clinical social worker with a Ph.D. in social work as well. So Heather, thank you so much for being here with us.
Thank you for having me.
Yeah, let's first talk a little bit about your background and how long you've been working in this field.
Oh, sure. I first got my MSW in 1991, so I've been working in mental health for a very long time. I've worked in inpatient, residential, outpatient settings, as well as in private practice.
Wonderful. Well, we're glad you were bringing that experience here with us. So let's just dive right in. Talk to us about what agoraphobia is and what it means to live with it.
Absolutely. So, one of the unexpected outcomes of the COVID-19 restrictions that we're all under right now has been that folks who have anxiety disorders or agoraphobia, excuse me, are presenting for treatment at higher rates, partly because services are more available now than they were before. As you said, you can get them anywhere. So to have agoraphobia, it literally translates as fear of the marketplace. So it's essentially a fear of fear. It's having the experience of being worried about being out in public alone, being in lines, being in crowds, all these things that we're really worried about right now. So if you have 2 out of 5 of these things where you're afraid to be in enclosed spaces, you're afraid to be in open spaces, you're afraid to be on public transportation, and it's changing the way that you go about your day-to-day life. If it's an exaggerated fear, if it's actually really impacting your ability to do the things that you're expected to do to fulfill your normal daily roles, then it may be a diagnosable disorder.
Okay. And so the restrictions with COVID-19, all the quarantine and the social distancing, how does that play in to someone who's suffering from this?
Yeah, so where those exaggerated fears may have been a symptom of a disorder all along, we now have some sort of validation of those fears on a global level, because we are all to some degree fearful about being in places where other people are crowded together. So it really has given both that support to the anxieties, which may escalate anxieties for people with anxiety disorders, but it also has to some degree normalized the experience of anxiety, which makes folks who have a disorder a little more willing to say, I'm really struggling with this right now. I need some help.
Okay. But the one positive that has come out of this is that treatment options have really expanded for this. So talk to us a little bit about that.
Yeah. And the fact that we've all been told to stay home, that it's safer to not be exposed in public places, means that payers, insurance companies, Medicaid, Medicare, as well as agencies that provide these services have really had to embrace the idea of doing telehealth. So we're able to provide services over video, like we're doing now, and through telephone contacts. And so whereas before, folks who were really trapped at home couldn't reach out and engage in regular high quality therapy, now are able to sort of make one phone call and get connected with a full assessment, a medication evaluation, and regular weekly, biweekly, monthly therapeutic sessions.
And how valuable is that to someone suffering from agoraphobia as opposed to other disorders? How much more valuable is that to them?
Yeah, it's immensely important. And so what we see is this silver lining to some of the COVID restrictions, that not only do you have the availability of services, but folks who struggle with these disorders are enormously relieved that no one is trying to shake their hand, that they're not really expected to give hugs in public anymore, that makes them more socially comfortable. And you add to that just the act of meeting a new provider can really trigger a full-blown panic episode for many people. You now take that personal, direct confrontation out of the exchange, and you can sit at home on your couch in a safe, stable environment and meet your doctor.
And so are you still able to get that quality of care through telehealth? Are you still able to do the same things that you would be able to do in an office in this type of setting?
Yeah, well, I mean, there are some differences, obviously, that when you're going for a medical checkup, the practitioner can't actually touch your arm to get your blood pressure, can't draw blood. But when we're able to use a video interface to see clients, we can still observe really important things that help us understand their base level of mental health. How is their self-care? How are they feeling? What does their face look like? It's really important in therapy to be able to read micro expressions, to make good eye contact, to sort of observe how someone physically responds to some of the interventions that we use in treatment. And so you get that through the video camera. And conversely, right now, as we're going back into the office and seeing some clients face to face, we're fully masked.
Right.
So we lose that direct contact with facial expressions, with eye contact. You've got the foggy glasses and the fact that we can't hear each other through the mask, that the slightest bit of hearing impairment becomes that much worse when you're wearing a mask and the person you're talking to is masked up. So there's some real benefits to shifting to a telehealth model.
Okay, but we're still able to do the cognitive behavioral therapy and everything else as well.
Yeah, a full array of treatment services available for anxiety disorders would include things like medication assessment and management, and those are really important elements of care. Cognitive behavioral therapy, as you said, is one direct approach to working with panic episodes and agoraphobia, that really looks at the interaction between what we think, how we feel, the ways that we behave. And these are really key things to look at in the treatment of agoraphobia.
Okay. And you personally have seen your cases increase.
I have. Anecdotally, my caseload of people with anxiety disorders and agoraphobia specifically has probably doubled, maybe more than that. It's really hard to say what the actual numbers are. But my clients are saying things like, I've been waiting a lifetime to be able to be in therapy. I know I needed help, but I could only go to 1 or 2 sessions, and then I would freak out and not be able to leave my house to go. So this has been an important, like a sea change in how clients are accessing services.
Wonderful. Well, we want everyone out there to know that BayView Professional Associates is here for them if they are struggling with these types of issues. And so we have a phone number for you for BayView, and it is 251-660-2360. And you can also visit us on our website as well, BayViewProfessional-associates.com, and find out more information about our programs and services and what all is available. Tell us a little bit about, what we can serve at BayView.
Well, when a client calls for services, they'll first be connected for a full assessment interview, and that usually will take place by telephone at this point. Initial paperwork is done touch-free now, so that it's all done through the internet when possible. When it's not possible, we schedule a discrete time for clients to come in and fill out that paperwork when no one else is in the office. After that, about a 50-minute interview with a clinician. And if medication assessment is necessary, then that referral gets made at that time, and we get you scheduled up for therapy sessions pretty rapidly, really.
Good. So we can handle it all right here at BayView Professional Associates. Is there anything else you want to share or leave them with before we wrap up?
That help is available, that these are really treatable disorders, and that your quality of life can be dramatically improved by being in regular, competent, high quality care. And that is so available right now.
All right. Well, we hope everyone took away something very special from this video today. And please continue to join us here at BayView Professional Associates online. Follow us on social media as well, as we hope to bring more and more resources to you.